Today, a CDC advisory panel is meeting to vote on recommendations about who will get the vaccines first once they're approved by the FDA. CBS News medical contributor, that's Dr. David Agus, joins us now to discuss that. David, always good to see you. You know, when you hear 20 million, that sounds like a big number, but it's not a big number when you consider how many people need the vaccine. So who gets it first? We keep hearing the elderly or other vulnerable or frontline workers. Is it an either-or situation? Do you have to choose between the two groups?
Well, we're going to see the end of today a recommendation by this Immunization Practice Committee of the CDC. And you've got about 21 million healthcare workers in the United States. You've got about 3 million long-term care or nursing home residents in the United States. And you've got about 20 million doses initially. And so, you know, to me, you have to put, even though it's myself, you have to put people at the front line who are risking their life to help others, and you have to vaccinate them to enable to care for others. And then when you look at the percentage of deaths in long-term care and nursing homes, it is dramatically high. 40% of deaths in the country are those individuals. So they are very at risk. Those two populations, I think, will be first. And then we're talking about elderly, other frontline workers, you know, people with medical issues and disabilities. But those put the numbers in the hundreds of millions who are going to require it. Over 100 million people with medical issues and elderly in this country. So it's going to be difficult, that second one. But we need to get the vaccine out, and hopefully it will happen soon.
Yeah, it looks like we're going to have a choice, David, between two vaccines. Which one are you recommending to the people that you care about?
Well, to me, whatever vaccine you can get first, you take. There's good.
You don't think one is better than the other? You don't think one is better than the other?
No.
No.
No, and I mean, there are going to be three candidates: AstraZeneca, Oxford, there's going to be Moderna, and there's going to be Pfizer. Each one of them have merits. Each one of them, 100%, have been able to block hospitalization and block people from being very sick with the virus. And that is the goal of the vaccine. Each one of them achieved that. So depending on where you live and what is distributed and, you know, what class you fall into, there may be 1, 2, or 3 being offered at that moment. But I would take whatever you can get right now. I like all three of them, which is an amazing thing to say.
Yeah. Yeah, listen, I'm glad to hear you say it. Once you get the vaccine, how long does it last?
The answer to that is we just don't know. So it lasts at least 6 months, and when we look at the antibody levels and the T-cell levels, it's going to be at least a year. At some point, you're going to need probably a booster, whether that be a 1 year, 2 year, 3 years, we don't know yet, but it's going to give us protection in the short run, which is what we care about.
All right, David Agus, thank you very much. You've given us some good information there. Thanks. Good to see you always.